Welcome to this explainer. You know, if you follow sports at all, there are three specific letters that can instantly silence an entire roaring stadium. ACL. It's wild to think about, really. It's just a tiny ligament, completely hidden away inside your leg. Yet, when it tears, it drastically halts an athlete's mobility, and it can alter their career and everyday quality of life for months. Today, we're taking a deep, fascinating look at the exact life cycle of an anterior cruciate ligament injury. We're going to explore the biomechanics of the knee, heavily focus on exactly why this injury happens so incredibly often during sports, and then walk step by step through the truly remarkable rehabilitation process that gets athletes back on their feet. Here is our roadmap for today's explainer. First, we'll officially meet your ACL. Then, we'll dig into our main focus, why sports specifically cause these injuries. After that, we'll cover the immediate aftermath, the early stages of recovery, and finally, what it actually takes to return to the game. All right, Section 1, meet your ACL. Because before we can understand how something breaks, we really need to understand how it's built in the first place. So what exactly is the ACL? Well, the anterior cruciate ligament is one of the four major ligaments holding your entire knee together. It helps to think of it as a biological bridge. It runs diagonally right through the middle of your knee, and its job is strictly to connect your thigh bone, the femur, down to your shin bone, the tibia. Now, it's roughly the size of your pinky finger. Pretty small, right? But it actually acts as the architectural keystone that keeps the upper and lower halves of your leg perfectly aligned. That tiny little bridge has a massive job description with three extremely vital roles. First up, it stabilizes the entire knee joint. Second, it basically acts as a physical leash, actively preventing the tibia, that shin bone, from sliding too far forward underneath the femur. And third, it controls rotational movements. Look, whenever you're running, jumping, or pivoting, your knee naturally wants to twist. The ACL is the strict, highly precise mechanism that keeps that twisting within a safe, functional limit. Moving right along to Section 2, why sports cause ACL injuries. This is the absolute core of what we're looking at today, the biomechanical risk. It really makes you wonder, right? We have this incredibly robust biological safety tether holding our leg together, yet we see it fail time and time again in almost every high-intensity sport out there. Why? Why is this incredibly vital ligament so easily destroyed out in the field, or the court, or the pitch? Well, to unpack this physical mystery, we have to look directly at the exact chaotic movements that overload it. The real culprits here are the high-impact, chaotic movements that are just completely inherent to competitive sports. We're talking about sudden twisting or pivoting. Imagine a soccer player rapidly dodging a defender at full speed. We're also looking at awkward landings after a jump, like a basketball player coming down unevenly while fighting for a rebound. Rapid changes in direction, a direct collision right to the side of the knee, or honestly, even just suddenly hitting the brakes while sprinting. These explosive athletic motions generate immense kinetic energy, which forces the knee to absorb forces from multiple unnatural angles, all at the exact same time. And when those athletic movements go wrong, it happens fast, like split-second fast. Step 1, the athlete executes that rapid change in direction or awkward landing. Step 2, that immense rotational force or forward momentum completely overpowers the surrounding muscles. The knee joint becomes physically unstable, it literally just gives way. And then Step 3, all that remaining kinetic energy has nowhere else to go. It transfers directly straight to the ACL. The bridge is pushed way past its maximum tensile strength, and in a fraction of a second, snap, the ligament entirely fails and tears. Which brings us to Section 3, the immediate aftermath. Let's look at exactly what happens right when that ligament fails. If you ask almost anyone who has experienced this injury, they will report the exact same incredibly visceral reality, a popping sensation. It's often not even just a sound you hear. It's a physical internal shockwave that you feel right at the exact moment the tissue gives out. Right after that pop, a really devastating cascade of symptoms kicks in immediately. The fallout includes sudden severe knee pain and rapid swelling because the joint starts filling up with fluid. The athlete will feel distinct knee instability. The joint simply can't hold them up anymore, and it feels like it's continuously giving way. This obviously leads to immediate difficulty walking, a severely reduced range of motion, and sharp pain during literally any weight-bearing activities. The knee's primary stabilizer is gone, and the body knows it instantly. To confirm the damage, medical professionals have to jump straight into a very strict diagnostic process. Step 1 is gathering a detailed medical history to understand the exact mechanics of how the knee twisted in the first place. Step 2 involves highly specific physical exams.
Doctors and physiotherapists use hands-on manipulations, specifically called the Lockman test, the interior drawer test, and the pivot shift test. Basically, they physically pull on the shin bone to see if that ACL leash is still actually intact. Finally, step 3 is the technological confirmation, an MRI scan to visually confirm the torn ligament, and very often an X-ray just to make absolutely sure there aren't any fractured bones.
All right, section 4, early stages of recovery. We're moving from the chaos of the actual injury into the highly structured solution, which is, of course, physiotherapy. The real work begins here. Recovering from an ACL tear is not a guessing game. It's a meticulously mapped 5-phase journey. It gives athletes a clear light at the end of the tunnel, starting all the way from basic swelling management and scaling all the way up to full athletic conditioning. Phase 1 is pretty straightforward. It's all about calming that traumatized joint down. I mean, you can't rebuild a house while it's still on fire, right? So the physiotherapist focuses on ice therapy, compression, and elevation, just to heavily flush out all that swelling. They'll introduce incredibly gentle range of motion exercises so the knee doesn't freeze up completely. And they provide safe weight-bearing guidance, which usually means getting you on crutches. Once that fire is put out and the pain finally decreases, the foundational goal of phase 2 is basically just moving like a normal human again. Therapy strictly aims to restore full knee flexion, meaning bending it all the way backward, and knee extension, straightening it out completely flat. By reclaiming that joint mobility, you achieve the ultimate prize of phase 2, getting the patient back to a normal, everyday walking pattern without a limp. And that brings us to section 5, returning to the game. This is where the aggressive rebuilding phase truly takes off. Simply put, strong muscles protect the knee. In phase 3, the primary goal is to essentially create a thick muscular shield around that vulnerable joint. Exercises heavily target the quadriceps on the front of the thigh and the hamstrings on the back. But honestly, it doesn't stop there. They also have to aggressively strengthen the glutes, the calves, and even engage in deep core stability exercises. The entire leg and trunk must work together to act as shock absorbers to protect that newly healing knee. Now, here's a genuinely fascinating side effect of this injury. Did you know ACL tears literally damage the body's internal GPS system? It's called proprioception. Basically, your brain momentarily forgets exactly where your knee is in space. Because of that, a physiotherapist incorporates critical balance board exercises, single leg standing, and complex stability drills. This functional movement training literally rewires the brain-to-knee connection, so the joint can learn to stabilize itself completely automatically out on the field. Finally, we hit phase 5, sport-specific rehabilitation. Before returning to actual competition, the athlete kind of has to face the very demons that caused the injury in the first place. The rehab progresses to intense running drills, agility exercises, jump training, pivot training, and really rapid direction change exercises. We're purposefully subjecting the knee back to those high-impact, chaotic movements, but in a highly controlled environment. We have to test that newly built muscular shield and those repaired biomechanics to ensure that when they finally step back onto the field, that knee is absolutely not going to fail again. The entire journey, from a split-second pivot gone wrong to a fully rehabilitated, game-ready knee, is just an absolute marvel of human resilience and medical science. Understanding the massive, chaotic loads we put on these tiny biological bridges really helps us appreciate the absolute necessity of proper conditioning. So whether you are just a weekend warrior playing pickup games or a deeply dedicated competitive athlete, I want to leave you with this final thought to consider about your own biomechanics. Look inward for a second. Are your muscles strong enough, and are your movements controlled enough? Ultimately, are your knees truly prepared for your next game?